Hello and welcome to the CVL podcast, coming to you from the UT Dallas Center for Vital Longevity, which is dedicated to pursuing research that leads to cognitive health for life. Our goal is to educate you on the latest matters relating to cognition and the brain, and with each episode we'll be interviewing leading scientists and sharing their insights and suggestions to promote cognitive health throughout the lifespan. My name is Amber Kidwai.
And my name is Sarah Munir.
And this is the CVL podcast.
In today's episode, we sit down with Dr. Elizabeth Davenport, an assistant professor of radiology and the technical director for the MEG Center of Excellence at UT Southwestern Medical Center. She received her undergraduate degree in biomedical engineering from North Carolina State University and earned her doctorate in biomedical engineering from Virginia Tech Wake Forest University in North Carolina. She then received advanced training in clinical MEG as a postdoctoral researcher at UT Southwestern in Joseph Malgin's Advanced Neuroscience Imaging Research Lab. Dr. Davenport's research primarily focuses on a critical question in sports medicine. What happens to athletes' brains when they take repeated hits to the head, even if those impacts don't result in concussions? Using advanced brain imaging techniques, including one called MEG, which stands for magnetoencephalography, she studies traumatic brain injuries, Alzheimer's disease, and other dementias. In today's episode, we begin by talking about the difference between concussions and subconcussive impacts, those seemingly minor hits that don't show immediate symptoms but could have lasting effects. We also discuss how a single season of contact sports can expose athletes to hundreds or even thousands of head impacts and what that means for brain health. Dr. Davenport explains the imaging techniques she uses to study brain trauma, including MEG scanning, and she shares insights about the brain's default mode network. We also discuss the relationship between head impacts and serious conditions like chronic traumatic encephalopathy, or CTE, and Alzheimer's disease, particularly focusing on how repeated impacts might increase the risk of developing these neurodegenerative disorders. Our conversation also covers topics such as the helmet safety debate and how recovery patterns can vary between individuals. Dr. Davenport also offers some tips on how we can better protect athletes' brains. This is such an important area of research that affects millions of athletes from youth leagues to the pros, and Dr. Davenport's research could help reshape how we think about player safety in sports. So whether you're an athlete, parent, coach, or simply someone interested in brain health, this conversation offers important insights into protecting our most vital organ. We hope you enjoy this episode.
Dr. Davenport, thank you so much for joining us today. Your research involves studying how repeated head injuries or impacts affect the brain, particularly in contact sports. So what sparked your interest in pursuing this field?
Thank you guys so much for having me. So my interest started originally, I was at NC State for undergrad in engineering, and I thought I might want to go to medical school, so I became an EMT and did that for a few years and experienced a lot of car crashes. And saw
not yourself, I hope.
Not myself. I responded to a lot of car crashes, and so then so I got interested in head injury research. And there happened to be a researcher at Wake Forest University who, Dr. Joel Stitzel, who was doing this crash injury research. So I started as a graduate student in his lab, along with Dr. Joseph Malgin, who is a neuroimaging researcher, and doing head injury research. Well, then they launched this study of football the first year that I was there, and it was so exciting to me to start on the ground level for a study like that and really dig in. I got to go to the football fields, interact with the parents. It was very exciting. And so I did all of my graduate work on that study of youth and high school football. And then I was recruited to come here to UT Southwestern along with Dr. Joseph Malgin when he moved, and start the MEG program, which is a type of neuroimaging. And so when we started to hear, I did my postdoc in the clinical applications of neuroimaging, but also continued the study of concussion. And now that I'm faculty, I've revamped our concussion study, and we're studying acute and kind of long-term effects of concussion in high school athletes. So continuing that work.
So could you help us better understand exactly what a concussion is, and also the distinction between concussions and subconcussions?
Sure. Yeah. So a concussion is a bump or blow to the head. Very importantly for people with kids, it does not mean that they have to be hit in the head. It can also be whiplash or a blast injury, say from the military. It doesn't mean you have to actually physically hit your head. And then they also don't have to lose consciousness. Mm-hmm. That's a common misconception. They can just have symptoms like nausea, vomiting, visual disturbances like seeing stars, or kind of the most common thing is having your bell rung and kind of feeling that vestibular imbalance, or kind of like your balance is off. So it's very symptom based. And then distinguishing the concussion from a subconcussive impact, the concussion results in clinical symptoms. They don't feel good, they're dizzy, whatever. And then the subconcussive impacts means that you hit your head or you experience some sort of whiplash, but you feel fine afterwards. And so those can actually be the same head impact, and for different people, identical head impacts, and one person will have a concussion, one person will be fine. We're not sure why yet.
So a subconcussion is they still have the injury, but they're just not showing the symptoms, basically.
Yes, I hesitate to call it injury, mainly because we get a lot of pushback from that. Because if there are no clinical symptoms, then are we sure it's an injury? And some of our research has shown, yes, we see changes that we associate with injury. But I'm so hesitant to call it an injury. But yeah.
So is there a distinction then between non-concussive and subconcussive impacts, since people do use both of those terms to describe head impacts that don't produce clinical symptoms?
There's not really a distinct difference between the two. Some groups may use them to distinguish something specific in a scientific journal, but in practice, they're the same. It's the same term.
So it's just different terminology, but
exactly
same meaning. Yeah.
Same meaning.
Okay.
Yeah. So
how would you diagnose? How are typically concussions and subconcussions diagnosed?
So they're not diagnosed. So part of it is that they are the subconcussive impacts are just impacts that are experienced during a regular season of play, when we're talking about sports, or a car crash when you come out and you feel fine. So I guess the part of the definition of subconcussive is that they're not diagnosed.
Yeah. Mm-hmm.
Yeah.
But what about for the concussions then?
What about the concussions?
How do they diagnose those?
Typically, so I believe in the state of Texas, it can be diagnosed by an athletic trainer. So, or you can be diagnosed by any physician with a concussion. A lot of times that's an ER physician, sometimes that's a sports medicine physician, but they're typically diagnosed by a medical health professional.
So do they do some imaging or testing or?
So okay, good question. So the way that they're diagnosed is they come in for an appointment with a medical professional, athletic trainer, sports physician, whoever, and they go through a series of questions. So we do what's called a post-concussion symptom inventory, where we ask them and we say, do you have a headache? Do you have dizziness? Do you have any of these type of symptoms? And then if they say yes to a couple of those, they'll go through and they'll give them neuropsych exams, which is an exam to test their reaction time. It's kind of like video games, but very boring. And so they'll test that. And then if they're concerned about a higher level than a concussion, a moderate traumatic brain injury, they'll do a CT or an MRI, some sort of medical imaging to rule out more serious things that are happening. But part of the definition of a concussion is that traditional neuroimaging is normal. So you go to the emergency room, you're really worried, you're like, I'm dizzy, whatever. You get that CT, it comes back normal, and they say, okay, you just have a concussion.
Yeah. So many individuals might be surprised to learn that an athlete can experience hundreds or even thousands of head impacts in a single season. So based on your research, could you walk us through what happens to the brain during these impacts, even when they don't result in a diagnosed concussion?
Yeah, so in general, when you think about the brain inside of the skull and what an impact, whether it's concussive or subconcussive, you can think of it as an egg in a jar, surrounded by water or some sort of other fluid. So that's your cerebrospinal fluid. And then if you move the jar forward and stop it very abruptly, the egg will continue sliding forward in the jar. And so that's what's happening with the brain, is that it's moving forward, and maybe not quite as drastically as the egg in the jar, but it's moving forward, and when your skull stops, the brain doesn't stop. It continued sliding forward. And so that they're very small movements, but that little bit of movement can cause micro damages, micro tears in the white matter and in the different neurons in the brain, or it can also cause this kind of release of neurotransmitters. So if you think of it as a sponge, when it hits the front and it kind of squishes the wrong way, it squishes out the fluid and the neurotransmitters that are there to keep your brain in balance. And so during a concussion, it's squished enough that you feel the imbalance, and that results in clinical symptoms.
Mm-hmm. So the research suggests that it's not just the number of impacts that affects these athletes, but also their magnitude that matters. So how do you measure and evaluate an athlete's cumulative exposure to head impacts?
That's a great question, because we recently changed our technology. So back when this study first started in 2012, we were using accelerometers that were implanted in the helmet of these football players, and they had springs on them, and they would kind of push into their head a little bit, like not uncomfortably, but just kind of as a snug hat. And we had 6 of them mounted in the helmet that would measure the linear and rotational acceleration, kind of similar to like the instrumentation in a smartphone now. And so what we have recently switched to, or what the field has recently switched to, is these kind of retainer or mouth guards, so that they clip into the top of your mouth, and they can just be put into a regular mouth guard, and then that can also measure the head impacts, which is really nice because it allows us to expand to unhelmeted sports like soccer.
Mm-hmm.
So one aspect of your work involves looking at the time between impacts. How does the spacing of these hits affect the brain's ability to recover?
I would love to answer that question, but I don't know that the research is there yet. We think that, or our hypothesis is that if the head impacts are really close together, it doesn't give your brain time to recover those neurotransmitters or that micro damage that happened. And so by having them too close together, not giving your brain a break, almost like a muscle, you give yourself time, a recovery day after you work out hard. We think that has an impact, but we're not sure. We don't have all of the evidence yet.
So your research is focused particularly on youth and high school athletes. What concerns should we have about subconcussive impacts in developing brains?
That's a great question. So the brains are developing. So they're going through this kind of careful, pruning process and development process, and we don't know 100% what the effect of head impacts are on that development process. From just kind of a cursory glance at people that have played football in the past, a lot of them go on to do wonderful things, and they're totally fine. But some of them, there's a couple of examples that I can think of that played high school football that ended up having their brains donated to a brain bank after they died in their 20s or 30s due to psychological illnesses and things like that showed evidence of this pathology in their brain that they correlated with their head impacts. Why that kid and another kid went on to go to Harvard and do great things, we're not sure exactly. We think there might be some genetic component there. There might be some component into the severity of impacts, how close they were together.
Okay, so some studies show that athletes experiencing more subconcussive impacts perform worse on memory and attention tests. So how early do these cognitive changes typically appear after the head trauma, and how long do we see these impairments?
How early do they appear after the head trauma?
Yeah.
And how long?
And how long do they last typically?
So from our current study of the subconcussive impacts in football, we saw a very, very slight decline in the reaction time at the end of the season. That study wasn't set up to longitudinally follow them to see how long it took them to recover. In our most recent study, where we're bringing in kids with concussion in the Dallas area, we've had I think about 9 participants so far. And what we've seen is that typically after 3 weeks, they recover on all of our typical testing materials. And so their reaction time, their scores on these tests are back to the norm levels.
Interesting. So what are the different imaging techniques that you use in your research, and how do they give us different insights in the brain trauma?
Sure. So my analogy for this one is that we use a couple of different methods, and I relate them all back to layers on Google Maps. So a CT is a very cursory glance, and it's almost like when you're looking at Google Maps and you just see the streets and kind of the gray areas. And so you're just like, okay, this is the picture of roughly what's going on. When we do an MRI, it gives us a little bit more detailed view of the structure. So I think of that as kind of like the satellite view on Google Maps. And then there's a functional component of MRI, as well as magnetoencephalography, or MEG, which is another functional metric. And those two functional metrics, what I relate those to is the traffic view. So where are the intersections clogged? Where's the flow happening? Things like that, and at what time? And so the resting state fMRI and the MEG is where I focus, and that tells us how is the brain sending signals back and forth, and to where, and how quickly.
So coming back to the resting state fMRI, which is when we scan the brain as someone is just resting in the scanner. So you specifically looked at a network in the brain called the default mode network. Could you explain this network and why it's important in understanding head trauma?
Sure. So the default mode network is actually a fairly new concept in the last couple of decades in brain research. But what it is that when people are at rest and just sitting there, not really thinking about anything specific, we see this default mode network, which is very specific areas that we know that are intertwined and that talk to each other when we're just sitting at rest. And it's kind of related to introspection and things like that. I think we see it heightened or disrupted in meditation. So it's we know that it changes in different states. What exactly those changes mean, we're still working on as a field.
So why is getting the resting state fMRI important for head trauma?
So it's important because we know that it changes in head trauma. So especially in moderate or severe TBI, we know that the default mode network can be totally disrupted. In more mild TBI or concussion, it's slightly disrupted. Why I like that a lot, why I like resting state a lot, is that we're not relying on this individual to perform a task in the scanner. So if they're feeling tired that day, if they're say they have a headache from their concussion, they're feeling dizzy, I don't need to ask them to do some sort of wild, get the ball in the bucket or whatever while they're in the scanner. They can just lay there.
And do you, for these resting state imagings that you do you take it at different time points for the athletes in your research?
Yes. So for
changes,
our most recent study, we do it post-concussion, 3 weeks after concussion, and then at 3 months post-concussion.
Okay.
So.
And do you see any changes there with resting state?
We have, actually. So we just finished processing some of our first data from our first few concussed participants. And what we saw is that at the initial acute phase, within the first 3 days of the concussion, we saw a change in the blood flow that we think correlates with where they were hit in the head. And then at the 3-week time point, we see a little bit of a return of the blood flow to that area. And then at the 3-month, it went totally back to normal. So that's an N of 1 right there. That's our very most recent data, but it's very promising.
Mm-hmm. So, I assume there are challenges in timing brain imaging after trauma. So what's the ideal window for capturing these changes, and why is timing so crucial?
Timing is super crucial, and it makes it hard when we're trying to do human studies, because from animal models we know that within 3 days of the 72 hours of the head impact, there is this that's when your neurotransmitters are still kind of going wonky, and they don't really return all the way to normal until about 72 hours after. So if a kid gets a concussion, we'd really love to have them in the scanner within that 72-hour time window, but these are busy athletes, busy parents. They're getting them into the scanner. So we've extended it to be within the first week. So within the first 7 to 10 days after the concussion, that's when we know that, when we've seen from animal models, that the blood flow starts to rebound towards normal. And we've seen from our first couple of subjects that we're even at 3 weeks, we're still seeing a subtle difference from normal, but still we want to get that acute phase.
So kind of like the ideal window is like that 72 hours to kind of get them in and see the damage.
Yes, ideally.
Yeah. So we often focus on football, but what other sports or activities should we be studying for potential brain impact concerns?
So we need to include women in the research, girls, especially in this pediatric age group. And so we've been trying to focus a lot on soccer because for high school females, that tends to be the highest incidence of concussion. There's also hockey, rugby. Australian football is having a real moment right now in head injury research, which is a super interesting twist on things. But really, field hockey, lacrosse, really anything where you're in a contact sport.
So research has shown that repeated head injuries can lead to a neurodegenerative condition called chronic traumatic encephalopathy, or CTE. So could you explain what this condition is and how it's related to subconcussive impacts?
Sure. So the first person diagnosed with CTE was back in 2005, and he was a center for the Pittsburgh Steelers for a long time, played a lot of football. And when they did he had a lot of behavioral problems. So he was very tended to be aggressive. He found himself homeless despite having a lot of family support. So he had a lot of psychological illness symptoms. And so when he died, they had an autopsy, and when they looked in his brain, they found amyloid and tau proteins, and those are typically associated with Alzheimer's or other types of neurodegenerative disorders, dementia, things like that. But what they saw was that it was in a different spatial pattern than that which we would expect for Alzheimer's. And so now they've seen this occur in many other individuals, not just NFL players, but also high school football players that have donated their brains posthumously. And so we're not sure exactly what the mechanism is there, but we do know that the spatial correlation of where those proteins are happening is where we see the head impacts as well. So towards the front of the brain, in our NFL players, we see a lot in the frontal lobe, and so that's often where they're getting head impacts as well.
I'm super interested that individuals as young as high school age can show these pathologies, because typically, you think of Alzheimer's as an age-related disorder, which shows these pathologies, these hallmark pathologies, but to have it as young as high school, that's really shocking.
It's wild, right?
Yeah.
So it's not everybody. I want to be very clear on that, because I feel like people often get scared and pull their kids out of sports when they hear this, but occasionally we see this, and we see it in high school football players, college football players that then go on to develop other these kind of psychiatric symptoms like the NFL players have, but why, we don't know.
So are there any developments in early detection or prevention of CTE?
Early detection, yes. So we can do something called a PET scan that will tell us if you have those proteins in your brain. The official diagnosis, last time I checked at least, is still, it's not diagnosed until after death and when they can do the autopsy. But we can still do those scans. In terms of prevention, that comes into play when we talk about head impact reductions in practices. So doing these non-contact practices, because the majority of head impacts, especially in football, occur during practice. So we have a lot of control over practice, right? So we can say, okay, we're only going to run the full tackling drill once instead of 5 times or something like that.
So there's been also a lot of research suggesting a connection between traumatic brain injury and an individual's risk of developing Alzheimer's disease. Are individuals who experience repeated subconcussive head injuries at a greater risk then of developing Alzheimer's in older age?
So far, we think yes. We think that if you have more subconcussive impacts, you are at a greater risk of developing a neurodegenerative disorder. We haven't 100% shown causation there, that the subconcussive is causing Alzheimer's. One thing is, I think that for a long time we called it Alzheimer's when in reality it was probably CTE, which that's a very slight distinction, but it's an important one.
So the distinction is more about where those pathologies start building up. So you mentioned in CTE, you'll see these pathologies in the areas where the head was impacted. Correct. Is that correct? Okay. Mm-hmm. And then with Alzheimer's, they typically start like in the memory regions of the brain, which is like near your ears, the temporal region. Yep. So I guess like when they're doing these PET scans, they can visualize where the spatial formation of these pathologies are, and that's how they can distinguish between CTE versus like Alzheimer's disease.
Exactly. Yeah.
Yeah.
So could you tell us about any patterns you've observed in how different individuals recover from similar impacts? Like what factors seem to influence their recovery time?
I wish I had a good answer to that. So there's been a lot of studies looking at different treatments to help people recover. The most benign one that I've seen has been stay hydrated, rest, but don't there used to be this thing called cocoon therapy, where they would stick kids in a dark room and just say rest until your head feels better. We've shown from a couple of different studies that that's maybe not the best decision, but at the same time you can't go back into your AP calculus class the day after your concussion and expect to just really nail it. And so if there's any patterns in terms of how they recover, that's one of the things that we're hoping to show with our research, is that if can I do a MEG or an fMRI or a neuroimaging scan and be able to better predict how you're going to recover long term. So even for the high school athletes, even if I can't offer a treatment right now, at least I can offer a more tailored plan and say, okay, look, from the scan, we think you're going to be fine in 2 weeks. So plan on that, adjust your class schedule. Next kid that comes in, maybe it's going to take them 4 months, and then we need to really look at, are we going to have to adjust your entire semester of classes, things like that.
I'm also curious to know, so with Alzheimer's disease, for example, there are genetic correlates that increases a person's risk for developing the disease. So you mentioned like with high schoolers who are athletes, you'll see that some of the individuals have these pathology accumulations. Do we know, based on research, if there's any like genetic link that increases a person's high school athlete's risk of developing these pathologies, whereas another high school athlete will not develop, similar damage?
So early research is suggesting that the APOE4 variant, which is a genetic variant that has been linked with Alzheimer's in the past, is something that could indicate that these people are more at risk.
Okay. So it's kind of a similar genetic basis as Alzheimer's.
Exactly. We're still, in our current study, we're collecting blood biomarkers to be able to do genetics. We haven't processed it yet. We have to wait until we get a full tray of 40 people before we can send it through the processing. But yeah, so what we're trying to figure out, are there other genetic variants? But right now in the literature, that seems to be the most prevalent.
So it could almost be like you have that genetic predisposition to neurodegeneration, and having the head impact is maybe accelerating or making it more likely that it will actually come into fruition.
Exactly. Yeah, that's what we're thinking. Yeah.
So I feel like people are much more aware of the risk of head injury now. It's taken a lot more seriously than it was in the past. Do you feel like things have improved as far as awareness of head impact and protection? And has this led to any reduction in the amount of head impacts you see in sports?
So much. It has improved just wildly from when I started in 2011. So I spent a lot of time at the football fields collecting this data, recruiting participants, and from that time to now, which has been, a little over a decade, the changes are phenomenal. There are much fewer head impacts in practice. Everyone is more educated. So the coaches get a lot. There's this thing called heads up football, which is training the coaches to reduce the head impacts during practice, like we talked about. And even in the NFL league, there's a book called League of Denial that is just super interesting. It's like a drama series on the research surrounding head injuries, but it's even that they denied for a long time, and now they're finally really embracing it and even funding research. So just in that short amount of time, once we showed the data, people really came around to say, okay, well, let's see what we don't want to end the sport, but we want to change it substantially to keep these kids safe.
So there is some controversy over the use of helmets in football and whether they protect from head injuries or may be the cause of worse injuries. Could you tell us a little bit about this?
Yeah, so I feel like the jury will always be out on this. It's been a debate since I started, but the purpose of the helmet is to prevent from things like hematomas or skull fractures. It can also reduce the amount of acceleration experienced by the brain. So similar to if you're in a car crash, instead of hitting the steering wheel, you hit the airbag, and that gives you a cushion to fall into. So the helmet is doing the same thing. It's giving your head a cushion to fall into. So if we go back to the analogy of the egg in the jar, instead of hitting something abruptly and stopping very, very quickly, it's still going to stop pretty quickly, but not as quickly because it's going to have that cushion that it runs into in the helmet. And so in that sense, it's very helpful. It protects against skull fractures, bruises, things like that. On the flip side, people seem to think that if a kid is wearing a helmet, that they will engage in more dangerous behavior. I can definitely see that. So what they've started doing, or kind of what I'm a fan of, is this mix of not wearing a helmet during practice when you have a lot of control, but then wearing it in the game when you're in that more risky scenario. You don't have as much control over what you're doing.
Yeah. So given what we know about the cumulative effects of the subconcussive head impact, what changes would you, based on the research you've done, what would you like to see in youth sports to better protect athletes?
My number one thing is that we need athletic trainers on the field. We need some sort of medical professional on the field. So at the NFL level, there's like 20 team doctors or something. There's a dentist on the sideline. They have everything, which is great. And I think that's fantastic that the NFL has taken those steps to keep their players safe. But at the youth level, there's not enough funding to do that. So at the minimum, I think there needs to be athletic trainers or an off-duty nurse or something on the sideline. And I don't think it should be a parent of a kid that's playing, because they're watching their kid, as they should. And so I think having that in place on the sidelines is the first thing that we can do to watch out for those signs and symptoms of concussion. The second thing that we can do is reduce head impacts during practice, keep developing safer helmets for when they need to wear the helmets. Virginia Tech is doing a lot of that work. If anybody's interested, they have a STAR helmet rating system that is funded by the government, and so they actually will test any bike helmets, football helmets out there, and give you an idea of how much acceleration is being reduced. So safer equipment, reducing head impacts, and athletic trainers, kind of backwards order.
Would you like to go over anything that we didn't cover today? Is there any research that you've been doing that you think would be interesting to talk in the podcast?
I think the only thing I have is we mentioned it briefly, is the magnetoencephalography work that's called MEG. And it's similar to fMRI, but it's less noisy, and it's a little bit easier to get in and out of. And so we're working on that as a new technology to diagnose and prognose, saying what's going to happen in the future, so kind of predict the recovery symptoms. And so that's something that we think is going to be really promising in the future, and just to be determined on when that will come to fruition.
Yeah, that's really interesting. So where can our listeners learn more about your research?
The Davenport lab at UT Southwestern. So we have a website there, and we try to keep it up to date as best as possible. And then if they are interested in being a subject for our studies, hopefully not, but if you have a concussion, we'd love to scan you. And so we have the recruitment on the Davenport lab website as well.
Awesome. Dr. Davenport, thank you so much for sharing your expertise with us today and the incredible work that you're doing to better understand the effects of head impact exposure on the brain and on cognition.
Thank you. Thank you for having me.
Thank you for listening to the CVL podcast. If you like what you're hearing, please follow and share with others. This podcast wouldn't be possible without the support of our team and the incredible work that goes on behind the scenes. We'd like to give special thanks to Soumya Sambamurthy and Josh Olivier for editing this episode. To learn more about the Center for Vital Longevity, just look up cvl.utdallas.edu, and here you'll find information about our research, as well as information on how to volunteer to participate in our studies and how to donate to support innovative research to understand, protect, and enhance the vitality of the mind across the lifespan. Join us next time as we continue to explore the latest research and strategies for keeping our brains healthy throughout our lives.